Hello, and welcome to today's webinar, Workplace Response to COVID, Your Questions Answered. My name is Stephanie Matos, and I will be your host for today's webinar. Before we begin, I would like to remind the audience to please feel free to submit questions throughout the event via the Q&A box on your webinar toolbar. Our presenter will be answering questions at the end of this webinar. Any technical questions you may have will be addressed as soon as possible. With the COVID-19 virus's impact on people and businesses growing more serious every day, many companies are left trying to figure out their best options for how to protect their employees, balance business needs, and satisfy client demands. Join our presenter, Claudia St. John, as they help us navigate this tough time. Ladies and gentlemen, at this time, I'd like to pass it over to Claudia St. John.
Thank you, Stephanie, and hi, everybody. It's another week of coronavirus. I was just saying to Stephanie, it feels like we're in dog years. Like coronavirus has changed time as we know it, and last week seems like 2.5 years ago. So welcome back. I've missed you. So I've kind of changed the title of this presentation, and it's now When COVID-19 Comes to Your Workplace or Comes to Work. The reason I've made that change is that in the presentations in previous weeks, we've been focusing a lot on the government responses that have been put forward for workers, both the requirements that you would have under the coronavirus, Family First Coronavirus Response Act with the emergency paid sick leave and the emergency paid family leave. Then we have the CARES Act, which provides for significant hardship bonuses and loans to businesses. So all of those things I imagine are sort of in place at this point. I'm not going to address them in my comments here, but as in weeks past, my goal is to give you about 30 minutes of content and then 30 minutes to answer your questions. And of course, any questions that we don't get answered, if we run out of time here, we'll follow up with answering them at a later date. So really what we're talking about today is what to do when you have an infection. So a little bit about who we are. I'm Claudia St. John. I'm the president of Affinity HR Group. We're not attorneys. We're not accountants. We're not finance people. So a lot of the questions that have been coming through, especially about the CARES Act, we've really struggled to provide answers to because that's not our field of excellence, but we are HR professionals. And in good days, in past, we used to help with recruiting and hiring and headhunting, employee engagement, employee handbooks. And I'm looking forward to future days because I'm currently reading the first 90 days so that I can get even more creative about onboarding because I'm trying to focus now. Instead of everybody laying everyone off, now I'm going to try and turn my energy to those bright days which are right ahead. I'm providing my contact information here, and I'll have it at the end as well. But do link in with me on LinkedIn and check out our blog. AffinityHRgroup.com is our website /blog. All of the resources that we have available, all of the contents, webinars, videos, documents, forms, everything that we come across that would be helpful for you, we put there. So either connect with me on LinkedIn or connect with me or check out our blog here. So moving forward, I'm going to show this slide again for those who've been through this, and it's just a reminder because we just have to keep remembering. No one's ever been through this before, but it is temporary. This too is going to pass. This is just a moment in time. So what we're doing here is really just trying to figure out ways to speed along the process of getting this virus contained and keeping our businesses up and running, and then going back to hopefully a new normal that may hopefully not be that much different than the old normal. But as we get there, again, just a reminder that what we're talking about here is bubblegum and rubber bands, right? So there are no ideas or perfect ways of doing this. We are all scrambling to stay afloat, to keep our businesses going, to keep our employees engaged and employed, and our customers satisfied as we go through. So we're trying to give as many resources as possible, but each one of these things that we're going to be talking about today, they're going to be unique. They're going to be unique to your work site. They're going to be unique to your specific employees. They're going to be unique to your specific industry. So there is no set answer. We are rubber banding and bubblegumming our way through this, but remember, it's going to pass. I promise you. And then we can talk about onboarding all of your folks when they're allowed to come back to work. So today we're talking about when COVID comes to work, and the reason for this content is a couple of weeks ago, we were talking about these legislative initiatives, but then last week it started. Last Tuesday I got my first call, which was, one of our employees is sick, and now we've just been confirmed that she has COVID. And then the next one, and then the next one. A tenant in our building has COVID. An employee's husband has COVID. We've been fielding many, many of these calls. So we're now feeling like we kind of know how to do it. The first one was scary, of course, and when it hits you, it's going to be scary, of course. But there are ways of dealing with it, keeping your workplace safe, getting back up and running as quickly as possible, and hopefully making it you able to be there emotionally for your employees who are facing this uncertain time. Another reminder about that, all eyes are on you. All eyes are watching you, how you deal with this. And they will be watching you when you have that call, when you find out that you have an infected employee, you've got perhaps a contaminated workplace, and what do you need to do? So seeing you be calm, seeing you handle the situation correctly, seeing you know that you've been preparing for this and you've got this and it's going to be okay and all employees are going to be okay and there is a plan, will go a long way to easing their stress and easing their anxiety, which will help them stay healthy in the long run. So I'm presuming that most of you on this call are essential employers, so you still have folks coming to work. You may also, of course, be working remotely, and so maybe not an essential employee, but not closed down. But this is really for those folks who still maintain a workplace and what to do when that workplace gets infected. But first, a moment on essential workers. I've been asked by a lot of different groups, am I essential, am I not essential? For example, if you are a car wash, for example, many of those car washes are not essential and they've had to close down, but some states have specifically spelled out that they are essential. There's two resources for you to look to for determining that. One is the federal site for determining who is essential. CISA, I believe the acronym is for that site. That describes what is conceptually an essential business and how you would deem yourself within that framework. But then each of these orders have been rolled out on both the state and the local level. And so as a result, you need to look to those orders to see how they define your business and whether you're essential. If you are essential and you're bringing your employees to work, we strongly recommend that if you have a uniform or if you have a dress code, if you've got a logoed shirt or a logoed hat, that you have employees wear that to and from work. And to bring with them a letter from you that specifies that you are deemed an essential work company and that the employee has the right to work, to drive to and from work. I would also encourage that your employee keep a pay stub. They can black out whatever dollar amounts, but to show that their name, their address, and your business are still working together. I would also make sure that those employees know that work release, that ability to drive and to be on the roads and outside of a quarantine is really something that they need to be very mindful of. And it is not to be used for them to go to the grocery store, for them to go out on joyrides, for them to go, for a picnic on the weekends. That if they are using that documentation for anything other than work purposes, they can be subject to discipline up to and including termination. So if you have not done that already, we recommend that you develop a policy so that employees know what their rights are and their obligations are under this, and that you give them the documentation, and that if you have a warehouse that has some logoed shirts or uniforms, now's a good time to have those employees using them going forward. Of course, prepare. Understand your responsibilities under the Families First Coronavirus Response Act so that everybody knows what they're allowed to have in terms of paid family leave and paid medical leave. Happy to give you all of that information or answer any questions that you have here. But if you go back onto our LinkedIn page or our blog on our website, you will find a lot of those resources. Anyone who you have still working in the office who has the capability of working from home should be home. Even though you're an essential business, your bookkeeper does not need to be on site if somebody else is on site to provide that support. If your customer service reps can work from home, they should be working from home. Truly, literally, everybody who can work from home should work from home, regardless of whether you are an essential company or not. That said, many folks still do have to work in the office, production work, other types of work. We do have a lot of employees in New York, believe it or not, that have no access to the internet, whether they're in the Adirondacks or in the Catskills. So across the country, there are many organizations that can't work from home. But if your folks can work from home, have them work from home. And of course, prepare your office, your workplace for social distancing. I would print out these hygiene recommendations, reminders, cover your cough, wash your hands. This is something that I wanted to share with you. Well, I'll share it with you in a second. That right there, that fellow with that yardstick, that is Tommy Kolchowski. He is a PSDA member. He reorganized his workplace so that nobody was closer than 6 feet across from each other. And he really did his best to do that social distancing. So he took a picture and sent it to me. So feel free to send me your social distancing pictures because they bring me great joy. And then, of course, cleaning supplies. Make sure that you're cleaning your areas, and I'm going to have some more recommendations on that. I know it's hard to get cleaning supplies, but if your employees have an extra bottle of Clorox bleach, or if you can identify through maybe the folks that are cleaning your offices whether you can buy some additional cleaning products from them, do so and keep that workplace as clean as possible. So for those who cannot work from home, you need to provide them with as much protection as possible. Increasingly now, the CDC is recommending that anybody who's outside of their home and in public, and public includes your workplace, just so that you know, when your employees are working for you, they are in a public space, and so therefore they should have the necessary protective gear. So we have now in New York State, we are not actually in our county, we're not allowed to go out of the house without wearing these, and we can only go out of the house on Tuesdays, Thursdays, and Saturdays. If you're in a location where that hasn't happened for you, that's great, but chances are it is going to happen for you. I was talking with a building service contractor this morning, and they had a couple of employees who are good at sewing, and so they sewed 2 face masks for every single one of their employees to wear at work. So take that seriously. We also have a promotional products company that put together Label King, these 6 feet please posters that are on, or stickers that people can wear just as constant reminders. Provide that protection for them. Remember, they're scared. They don't necessarily want to be working. They would rather be home safe and sound if they could. So take that seriously. Make sure you give them protection, the protective gear necessary. Prioritize that social distancing and practice those safe cleaning habits. Now is the time to shut down your kitchen. Shut down your kitchen. Lock up your refrigerator. No more coffee. Maybe go buy them each a thermos so they can bring their own coffee to work, but you need to stop having communal spaces. Close down your kitchen, close down your water fountain, bring in bottles, little bottles of water that people can use and take care of. You also need to listen to their concerns, especially if you're setting up the workplace for them to feel safe. Listen to them. They may have some ideas on staff rotation, on work location, on pre-prep and post-prep work, how it can be done so that you minimize people's interaction with each other. You also want to take a look at your paid time off policies. Now is the time to be as liberal as possible as you can be. You do not want folks coming to work because they don't have paid time off, or coming to work because they don't want to use their paid time off and they're sick. You do not want sick people coming to work. And so whatever you can do to liberalize your PTO policy, now is the time to do it. And again, we're not doing it forever, and you don't have to do it for everybody. You can just do it for the folks that are showing up at work. Some folks are considering hazard pay for those who have to show up at work, whereas some of their employees can work from home and some of their employees have to come to the office. The folks that have to come to the office get some sort of an incentive or a subsidy, maybe some additional PTO in case they do get sick. All of these things, again, rubber band and bubble gum, but think about ways to incentivize your employees who are showing up at work, recognizing they're scared. Their families are upset that they have to leave the house and go to work. They're probably upset that they have to do that too. So anything you can do to soften that blow, I really recommend you do that. When you have vulnerable employees, and many of us do, whether they're elderly or immunocompromised, whatever those situations are, again, we encourage you to have conversations with them. You can provide recommendations on workplace accommodations for them. You cannot insist that they take them. Under the Americans with Disabilities Act, you cannot force an accommodation on somebody that would discriminate against them because of their age or their health status. But do offer that to them. It's in everybody's interest to protect our vulnerable employees. So please have those conversations with them. And again, it's very, very essential that you keep everybody's situation confidential. Under HIPAA and the Americans with Disabilities Act, you cannot share that information. You need to keep that confidential. Even when somebody shows up sick, you should not be divulging who is sick. You should not be divulging why Lou is no longer working at the office. Well, maybe you're making an accommodation for him that he doesn't want made public. Maybe he didn't want to share his health status or health condition or the circumstances around him. So try to maintain everybody's confidentiality. If you do have an exposure, you need to remember that every situation is unique. And by exposure, we've heard things like, my bookkeeper's husband's father has COVID. Should she self-quarantine? Well, she hasn't necessarily had that exposure with the father. Maybe she has exposure with her husband, and the husband had exposure to his father. But if you're showing those symptoms and he's showing those symptoms, perhaps wait and keep an eye out. And if the situation changes, then consider a stay-at-home order for that employee for 14 days. And some of them, they're much closer. My husband has it. Well, if your husband has it, the chances are that you may have it. You should self-quarantine. So those are decisions that it's a gray area. The resource that we've been relying on in all of this is the CDC recommendations. They've got a very robust site. They're adding more Q&As. They're adding more materials as time goes on. So if it's been a while since you've checked out that site, you may want to do it. But remember, each one of these cases is unique. And so in order to, whether you recommend quarantining or not, because of some form of exposure, we can get like 3rd or 4th or 5th degrees of separation here. So again, the more immediate the exposure, the more severe the element, the illness that the individual has been exposed to, that will guide you largely in whether to send them home or keep them in. If you keep them in and they suspect that they've had any exposure, there is no reason why you should not be having them wear a face mask while they're coming to work, even though they may have had some remote exposure. This keeps everybody safe. It keeps them safe, and it keeps all of the other employees safe. So anyone who suspects that they've had any kind of exposure and is coming to your office, make sure they're wearing a face mask. Okay, so what happens when somebody gets sick? So symptoms show up between 2 and 14 days after an exposure. Make sure your employees know all of the symptoms of COVID. If they're showing any of them, fever, cough, shortness of breath, difficulty breathing, tiredness, aches, runny nose, sore throat, diarrhea, any of these symptoms, if they are showing any of them, they need to stay home. This is why we might want to consider a more liberal PTO policy for this period of time. We want people who don't feel well to stay home. Of course, it's happening at the same time as seasonal, allergies kick in, and we do still have a legitimate flu rocketing around. And so we do have to make those determinations. But right now, if you haven't already, tell every single employee what the symptoms are for COVID-19, and if they are showing any of them, they are to call in and not to go to work. You can also send them the site. On the CDC, it says, what symptoms, what should I do if I'm sick? And it shows what the symptoms are and what you can do. It's a great resource. I recommend that you send it to all employees or send it to them in the form of a memo for good prevention. We've had a lot of questions. Can we take the temperature of our employees? We have many clients who now have come to us and developed a policy for testing their employees. Here's the word on that. So yes, the EEOC has said that you can take the temperature of your employees, but you cannot discriminate against any particular class or type of person in that testing. So you test one, you test them all. If this is going to be your approach, then you make this approach unilaterally. We do have building service contractors whose clients now want all of the cleaning staff to have their temperatures taken before they come on site to do their cleaning work, but they're not requiring that of the tenants of the building as well. That is legally treacherous. If you're going to test one, you should test everybody for the same purpose. I also strongly recommend that you consider whether or not it's even helpful to do so. A fever can be remediated with fever reducers, and in addition, they're saying now, horrifyingly, that perhaps 50% of people who have active COVID and are contagious show no symptoms whatsoever. So, I think taking temperatures is more a feel-good measure than an actual helpful one. But nonetheless, if you do it for everybody. Now, some folks are saying, can we require them to have testing? Can we actually require them to have a COVID test? Good luck would be the first answer that I would have. I wish we all had more testing available to us. It's very hard to come by and usually requires a doctor's note. But more than that, the EEOC has guided us by saying that a COVID test is actually considered a medical procedure, and employers cannot require an employee to have a medical procedure. The only time that there is some gray area here is if you are, for example, a healthcare provider, or if you work in a nursing home or some other location where there is a high prevalence of risk and exposure. But again, you still have to get the tests, which is not easy still. It is still not easy to get them. So, oops, sorry, I went backwards. No, I'm still going backwards. Sorry, everybody. So if an employee shows up sick, number one, here are the things that you need to do. Send her home. Close off all of the areas of exposure where she has been. So that means any areas that she has been occupying, hanging out. If she did not go into the mailroom, you do not need to clean the mailroom. They're saying that the virus can go about 6 feet from somebody unless it is aerosol, in which case it floats around in the air. But if she was not in that space, it will not be there. So you really want to close off any areas where she has been. Poor thing, she looks miserable. You want to notify all of your employees that there has been an exposure, but you do not want to tell anybody who it is who has been exposed. You need to protect that person's privacy. That said, if there's only 4 people in the workplace and 3 people are standing there that you're telling, they'll figure it out. But to the best of your ability, you really want to protect that privacy of that employee. The folks that have been in contact with her, according to the CDC site, if they've been in close proximity to her within the last 12 days, and that close proximity is working close together within 6 feet of her, they are at risk. So if you have a confirmed case and you have somebody who's worked closely with her, send her home for the duration of her illness and send the other exposed employee home for the 12 days. Now, that when you send the employee who was exposed to her home, If she does not have a doctor's note or health authority that she should be quarantined, it's a little questionable whether she would be eligible for that paid sick leave under the Families First. But as long as you have some documentation to show that there was close exposure and that it was a known, confirmed coronavirus exposure, she should qualify for that paid leave under the Families First Coronavirus Response Act. This employee definitely will, because she is sick. And so she will go home because she has the symptoms of the coronavirus. Again, you want to recommend that quarantine for those who are in close contact. And then you want to follow the CDC's guidelines, and I will go through those with you, for professional cleaning and disinfecting. They have a very long list of how to clean and disinfect your workplace. My recommendation to you is to talk now with your professional cleaning company to see if they do disinfecting work. If they cannot disinfect your workplace, you should probably call somebody who is in the business to disinfect that workplace and bring them in, perhaps to do an initial screen so that they know your space, they know your facility, they know what is required, and they will be able to move quickly if you do have an infection. And again, the CDC has a number of guidelines for this. The other thing is, if you do have some kind of exposure and you have a regular cleaning crew that comes in regularly, you need to notify them so that they don the correct protective equipment so that they, your normal house cleaners, your office cleaners, are protected. If that employee goes out, you should have them fill out a request for emergency paid leave. This form we developed for you. It's on our blog. Happy to send it to you. Send me an email. But we've got this which you can use to collect the information necessary to validate that you have an employee who qualifies for federal reimbursement of the leave under the Families First Coronavirus Response Act. This form will suffice for whether it is sick leave or paid family leave. So this document is available to you to use. It's compliant with the IRS and the DOL, so it should help should anybody come down with needing that leave. What the CDC requires of you when you have somebody who has been sick in your building, the first thing to do is to close off the area visited by the ill person. So close off all of the areas where that individual was. Open the outside doors and windows and use ventilating fans to increase the air circulation in the area. This is something that's very interesting, I think. The virus is actually a protein. It is not alive. It is a protein that lives inside of a shell that's made of a lipid or a fat. And so that's why when you use soap, it's like Dove gets that grease out. The Dove, that hand soap cuts through that fat layer, and the minute that fat layer is gone and that protein is exposed, it dies. So that's why we think that when it gets a little bit more humid and it gets a little bit warmer, that perhaps viruses like this don't like that. But they do recommend that you clean out that you open up the ventilation for hopefully at least 24 hours or as long as you practically can wait before you do the cleaning and disinfecting. So air it out and leave it alone for 24 hours. Again, these are the CDC recommended guidelines. Cleaning staff should clean and disinfect all of the communal areas, such as offices, bathrooms, keyboards, desks, everything that you have, remote controls, anything, any touch screens, telephones, everything that they could possibly touch, focusing especially on those surfaces like bathroom doors, doorknobs, places where a lot of people are touching. If it has been more than 7 days, additional cleaning may not be necessary. We had a call on Monday with a man who, it turns out, an employee did come down, got tested, and confirmed to have COVID, but he had been out sick since the 25th of March. And so when I talked to him, he was already 12 days in. So at that point, if nobody else in the building had shown any symptoms and it had been 12 days since that employee had showed up, really all you want them to do is keep an eye on that work, on the rest of those employees for the next couple of days. But once 14 days has passed, you're pretty much in the clear, but you may want to do a little extra disinfecting of the workspace and station where that employee worked. But you don't need this big top to bottom clean if necessary, if it has been a long time since that exposure took place. So hopefully all of your employees will be restored to full health. And for those of you who have not experienced it yet, I just want you to know, I'm outside Syracuse, New York, and we had nothing, and now we have a ton. And this spikes very quickly, and so you can go from not having to deal with this to all of a sudden having to deal with this in a hurry. So when your folks do fall ill, remember that when they want to return back, the recovered employee has to have no fever for 72 hours without the use of a fever reducer, and they should have improved respiratory conditions, so their cough or difficulty breathing is better, and it's been 7 days since the onset of their symptoms. So they need to satisfy all of these in order for them to return to work. Now, that's for most people who have not had a coronavirus test. Only a fraction of those with coronavirus have been tested. Those of you who have been tested, they have to satisfy all of those above. So no fever with fever reducer, feeling better with respiratory ailments, and 7 days, for at least 7 days from the onset. And they should be testing negative on a subsequent coronavirus test twice. Once negative, and then another 24 hours to get a second test. And this is because they're seeing that there is an element of perhaps contagion after they have recovered and no longer have any symptoms. So this is what the CDC recommends. So these are my top 10 ideas for you, and then I will take your questions. First is prepare your office with social distancing and remote work. Send everybody home who can work home. Make sure that you're posting the Families First coronavirus sick leave and medical leave information. You also want to look at your PTO policy. Be as liberal as you can. You do not want anyone showing up who doesn't need to. You may also want to look at your handbook and check out that leave form for folks who need to take emergency leave. Talk with your vulnerable employees and make sure that they are taken care of to the best of their ability. Ensure employees know what the symptoms are. Contact a professional cleaner now. Get that done ahead of time so that you don't have to be wondering what you're going to do when you have an infection. You've already covered that base. Be prepared for the conversations with employees. Be calm. All eyes are on you. You've got this. This is not going to be around forever, but while we have it, while we're concerned, we're going to make sure we do everything that the officials recommend that we do. And I also recommend that folks start donning that protective gear, those face masks and things at work while they're there to alleviate their concerns. Figure out a strategy for those who want to stay home. A lot of folks don't want to come to work. What we've learned is that if they just refuse to come to work, they cannot get covered under the Families First emergency leaves. So have a conversation with them about going on unemployment. What does that look like? You cannot promise that somebody will be eligible for unemployment. If you have work for them and they simply don't want to work, the state will determine whether or not they can collect unemployment. In this day and age, they're trying to liberalize that a lot. But in the meantime, don't make any promises that they can get unemployment because it's not your call. It's the state call. But let them know that that's the option that's available to them. Before you let them back in the office, you want to make sure that they're released, and hopefully they will have shown all of those positive symptoms and have their doctor say that they're ready to come back to work. It's best to have that documentation if possible, so it's not just an employee making that determination on their own. But you don't want to force a healthy employee to have to go back into a doctor's office, which may already be very strained and stressed because of the workload that they're having to deal with. So if they can get a letter from the office, indicating that that they're free to return to work, that's your best approach. And of course, stay calm, stay open, and stay understanding for the situations that people are dealing with. We do recommend that you check out the CDC guidance for businesses. Just Google that and you'll get it. I also want to let you know that Affinity HR Group, we're now getting these calls, and so every situation is different. Like dealing with Lou, his exposure is different than Susan's exposure, and how do we deal with those two differences, and what do we tell employees, and what kind of communication should we have, and when do we return them back to work, and will they qualify? We've been getting all of these follow-up questions. Like, it's not just one question, it's lots of little questions. So we're offering this COVID support hour. It's a prepaid hour. It's discounted off of our normal hour rates, and we're now taking it in small increments, 10 minutes, 5 minutes, so that we can just answer your questions. It's a peace of mind for you to have that, you know, we're here for all of those evolving questions as they occur. And of course, we will continue to be here for you for as long as we have to. I hate COVID, but at least it gives us the opportunity to visit on a weekly basis. That's all I got. Stephanie, are you there?
I am. You ready for questions?
I am.
Okay, so first question that's come through. I think you might have touched on this, but I just want to make sure that everybody understood the concept. What about if a building janitorial employee tests positive? This is a concern because the individual does have access to the entire building and other crew members. What's the best practice for handling that, both with the client or property owner or manager and the crew that might have come in contact with the infected employee?
If you know that you have an employee who's been infected, you need to notify all of the places where that employee has been. So you would need to notify the property manager, the property owner, as well as any of the crew that they are with, letting them know the nature of the exposure, whether this individual was exposed and has symptoms or does not have symptoms. If they had a very close amount of contact with that employee, you may want to recommend that they self-quarantine. And if that's a recommendation that you're making, you may want to have them get that recommendation from their doctor so that they can qualify for the paid sick leave. So if you just send them home to self-quarantine, that won't qualify. They need to be advised to do so by a medical professional or a public health official. So your public health, it depends. Your public health may get involved in that circumstance, or they may not, but you want them to get a note from their doctor. And in terms of the workplace, I would make sure that they know that they had this exposure and follow the same cleaning guidelines for that workplace as possible. Now would also be a very good time for all of your employees who are going into buildings to clean to be wearing face masks, to be wearing gloves, so that you're creating at least an additional barrier for that exposure. And I'm sure that your tenants will appreciate that all employees there are, that are going through from place to place to place within your building are wearing appropriate protective gear and are trained on how to wear that protective gear. But an employee, a cleaning service employee that is exposed and is working in a building is the same thing as an employee who is exposed. They may not be there as long, but following up with a clean is appropriate. And again, the CDC guidelines are very in-depth on what to do with different exposures, what chemicals to use. The EPA has just released a new list of chemicals that work versus those that don't. So again, lots of resources out there for disinfecting that building.
Okay, thank you. Have a FCRA sick leave question.
Sure.
If your employee has a letter from a doctor saying they should self-quarantine because their partner is a caregiver to a high-risk parent, would that employee qualify for FFCRA sick leave?
I think that's dodgy because there's no underlying healthcare condition that the employee has, and the husband is not exposed. He's not sick. He's just caring for somebody who is high risk. So this is where you get to those sort of second and third degrees of separation. However, if that employee has COPD or other significant underlying health ailments and their doctor is telling them, look, you catch this, you die, then that would qualify. A doctor's note from that for that individual based on their own health risk would qualify. But simply being being the spouse of somebody who works in a place where they could get exposed is not, it's a little too far for what at least they have defined in the Families First Coronavirus Response Act. I would also recommend the Department of Labor, which is where that act came out of, has a very robust Q&A portal now, and they're adding to it. So every couple of days, there's a couple more Q&As. So keep an eye on that, keep checking on that to see if they offer any more clarity on it. They also indicated that you could be eligible for self-quarantine or for staying for the paid sick leave if deemed so by a condition as determined by the Secretary of Labor and Secretary of Health. I have no idea what that means. Every attorney I've talked to has no idea what that means. So I'm imagining, since they put it in there recently, that it's a placeholder for something else to come. I just don't know what that is yet. So keep an eye on that site. And of course, if we learn anything more, we'll let you know.
Okay. Another sick leave question. An employee who had a fever, if an employee has a fever and calls in sick, do they qualify for the April 1st sick pay? And if they stay home for the 14 days, do they need medical proof to return?
So if an employee has a fever, they should contact their medical provider and talk to them about that. Anybody who's showing up with a fever should contact their doctor. If the suspicion is that it's coronavirus based on the doctor's consultation with that employee, then yes, they definitely would qualify. So it's really up to the doctor to make that determination or not. If they are, if they have a fever, the determination is that they are fever-free for 7 days. It's 7 days since their first symptom, so once they got the fever, and it's 3 days since they've had the fever without using a fever reducer, and they show no other symptoms or improved symptoms before they can come to work. So they don't necessarily have to wait 14 days because we don't know that this is an exposure. They're sick now, so the clock starts with they're sick. Here's what you have to do before you're allowed back to work. 7 days from the onset, 3 days since their fever went away, and improved overall health and condition.
Okay. A question about, thank you for that, a question about higher risk individuals coming into the workplace. Are higher risk individuals, like people who have asthma, for example, are they allowed to bring in their own proper personal protective equipment to avoid exposure, especially if a building or area is being cleaned with potentially harsher chemicals that could be damaging to their health?
I would say absolutely. I would say absolutely. I think in this day and age, again, rubber bands and bubble gum, if you've got somebody who's high risk and they have a higher quality personal protective material for them, or they've got allergies, or not allergies, but sensitivities to the chemicals, I would definitely allow them to wear whatever protective gear necessary, and I would look to perhaps extending that protective gear to others as well who may want them or need it. So yes, now is the time to wear all of your personal protective gear. Now is the time to do whatever you can to make sure people are healthy and people feel safe as well as are safe.
Okay. Question about OSHA. If you strongly suggest, if an employer strongly suggests their employee comes into work, if they are resistant, and then if that employee is resistant, to come into work, and then they contract COVID, does that constitute an OSHA recordable incident?
So what I have read, and OSHA has released some guidelines on this, so I encourage you to Google OSHA and COVID, and there is a 39-page manual that I have read on COVID. And what we've determined is that it is a recordable event. So yes, you do need to record that. However, it doesn't mean that there will be any adverse impact as a result of that recordable event. So what the penalties are for having that is still a little unclear to me, although others on this call may pursue that. We don't really get involved with OSHA that much, so but I do know that it is a recordable event. I have also gotten the question about whether it's a workers' comp claim that somebody got sick while at work and whether or not that would qualify them for workers' comp. What we've learned is that it would be very, very hard for most employees to determine or to prove that they got sick while at work, because it is in the community now. So being able to determine, just because I came to work, where I also went to the grocery store and I also went to the bank and I also went to the pharmacy and all these other places where it could be. That said, it is a little questionable about whether or not, if you have an employee, for let's say is a healthcare provider, and they are working face to face with infection as part of their job, that's a little bit of a stronger case for COVID, because they are being exposed regularly to this. But in terms of OSHA, yes, it is a recordable event.
Okay. Thank you.
Sure.
Last question that's come in so far. For employees who may be able to work from home but have children who have to also be there because of school and things and might be distracting, what do you recommend in terms of less than efficient production?
Well, I think I don't think any of us are really killing it in terms of productivity with all of us working from home. I mean, some maybe, but you may have to tolerate a little bit less productivity. You may have to tolerate that somebody's going to have reduced hours during the day when they can work, if they can make them up at night. We're really just trying to get as much as we can, as far as we can with the current situation. That said, I would try to be creative. All of the schools, for the most part, all of the colleges, for the most part, are closed down. That means that those individuals are out and about in the community. If you know they're there and they're willing to be child care providers to your kids and you trust having them in your house, then I would look at maybe reimbursing the employee for doing that time. The other thing is reimburse the employee for having to hire a babysitter. The other thing that I would say is that one thing that they did clarify is that with the Families First Response Act, you can take that intermittently. So if the family member, if the employee's spouse perhaps, or someone else can come in and watch the children at some point in time so that they can get productive, they can take that leave intermittently when they don't have childcare available to them.
Thank you for that. We had another question that just came through the pipe. If an employee, it's about the Sick Leave Act, if an employee was sent home showing symptoms, fever and cough, but they use telehealth, and the telehealth doctor says they don't test positive, or they potentially do not show the same symptoms for COVID-19, should they still stay home for the 7 days? And are they eligible for the Family Paid Sick Leave Act, even though it is not COVID-19?
I do not think they would be eligible for the Sick Leave Act, because they have not been determined, diagnosed by a doctor to have symptoms of COVID. So if a doctor says you don't have symptoms of COVID, you're not displaying symptoms of COVID, then I don't think it would be covered. But that doesn't mean you want to rush to have them back in the office. This is where I'd be a little creative about your PTO. You may just want to keep that employee out until they are returned to health and pay them for that. So that just because the federal government's not going to reimburse you for this amount doesn't mean that you shouldn't, have them take that leave, either their own PTO or offer, a new PTO. And again, if you've got folks that still have to come into the office, and they're not well, you don't want them there. Nobody's going to feel comfortable being around somebody who's sneezing. Nobody's going to feel comfortable going to that workplace, and the employee doesn't want to be exposing others. So my best advice, and this is the advice that I've given the folks that have called us, because we've gotten this question 15 different times in 15 different ways, just send them home. Send them home, pay them, and just keep your workplace as illness-free from whatever illness as possible. Because the other thing is, you need to realize, if you have somebody who's compromised, has a compromised health condition at work, and they pick up whatever that guy has, and then they get COVID, they're a lot worse off. So in all ways, it's best to keep the workplace symptom-free. If you do have to bring them back for whatever reason, that's when you want to make sure you've got these protective gears, whether it's homemade or whether it's store-bought or whatever. If you have a promotional product distributorship that you can get these from, because those folks know how to source from China and they're getting in these personal protective gear. You want everybody wearing it anyway. You definitely want people who have symptoms to be wearing it.
Okay, thank you. One more question just came in. Do you have any resources that maybe Affinity HR group has used, or any resources you've heard from your clients about obtaining or where to purchase personal protective equipment or just protective products for employees in the office?
Yes, actually. So it's really interesting. I literally just mentioned it, but the folks who do your promotional products, so the folks who do maybe your business cards and your logo, maybe your apparel, a lot of them have gotten really creative in a couple of ways. First of all, many of them are now working with businesses who are now providing that. So for example, my promotional company, I was out of hand sanitizer and I bought branded hand sanitizer. This was made by a distiller who was a gin distillery or some form of spirits distillery in Charlottesville, Virginia, and they converted it over to a hand sanitizer. And so I got 100 of these for $89. So I don't know what I'm going to do with 100 of them, but if there's another coronavirus, I am now protected. So they will know if there are industries in your area that are now, apparel companies that are now making face masks. I made this. Any of us with a sewing machine can do it. They've got a lot of recommendations out there on how to do it yourself with I don't know what staplers and bubble gum and rubber bands, basically. So the worst case, you want to do your own, but otherwise, your promotional products, folks, they are also sourcing folks that are doing this, but they also are expert at sourcing product in China. They know how to do this. They know where to find the distributors. They know where to get the information. They are the ones who are really good. So I strongly recommend you talk to your promotional products, folks. And if you don't have a promotional products, folks, call me, because we have a ton of them as clients. They are a Smith-Buckland Association member. I'm sure quite a few of them are on this call. That guy with the tape measure and the first, Tommy Kulczewski, he'll get them for you.
All right, that seems like that's all the questions we have. That's between chat and the question box. So that's all I've got.
Thank you. Well, let me just say a parting word to all of you, and that is, I actually did have a little moment last week where I sat down and had a good cry. And that was because I realized that now things were going to get a little scary, because now the infections were showing up, and I'm just really worried. So if you are in that situation, even just for some moral support, we are going through it now. We are experiencing it now. You do have folks who've had this experience, who know what to do, who've been through it already. So rely on that. Rely on your peers. Give us a call. We are going to continue to be here for you as we go through this. And we will get through this. This is a brief moment in time. It seems like a freaking eternity, but we will get through this, and we will be back to the business of doing business very, very shortly. Do connect with me on LinkedIn. Do check our blog out. Do email me, call me if you need anything. Don't hesitate. That's really what we're doing now.
Okay. Thank you so much, Claudia. Thank you to Claudia as our speaker today. Before leaving, we'd like to gather your feedback on today's webinar content. So please take a moment to respond to the poll questions that have popped up on your screen. We will be following up within the next 24 to 48 hours with the recording of today's program. Thank you so much for attending today's webinar. And once you've taken that poll, have a great day. Thank you so much.
Great. Thanks, everybody. Take care.